All around the world, there are diseases that, in most cases, never surface in your day-to-day life. Some of them cause outbreaks, while others never make the headlines. Collectively, we call them emerging infectious diseases. These diseases can spread in a number of ways, including traveling with us, sometimes thousands of miles, passing from sick people to others, or through a bite from an infected insect or contact with a sick animal. But have no fear. There are highly trained teams of experts that stay constantly alert to search for, track, and prevent these diseases. When an emerging infectious disease is identified, the public health system is alerted, and the investigation begins. Samples are collected and sent to a public health laboratory for testing and analysis. The laboratory scientists study the disease, looking for features that may be used for detection, identification, and prevention. Findings are shared worldwide, so the public health system can quickly and effectively track the disease and prevent it from spreading. Meanwhile, back at the lab, public health laboratory scientists continue testing, watching and preparing for the next disease to emerge, ultimately providing a safer and healthier way of life for you. Learn more about how public health laboratories work to keep you safe.
University Dialogue. This is a platform where we weekly sensitize government discuss topical issues. You may recall last week we discussed positive comments, reactions, and feedback. We did discuss the topic. It is Dr. VETTY AGALA from Rivers State Ministry of Health as the State Promotion Officer and the pillar lead of risk communication and community engagement. You're welcome, Doctor.
Thank you very much.
And I believe you're just coming for the second time. Thank you for making it out to us.
Thank you for having me.
And I am Mrs. Ifoma Ilodigwe, your anchor for today's dialogue. Also, viewers, you are an important guest in this program. So feel free to hit the comment section, make your suggestions, contributions, ask your questions, and in due time, the telephone line will also be open to take your calls. However, make it brief, tell us your name and your location. Thank you and enjoy your stay with us. All right, Doctor, before we proceed, we are talking about emerging and re-emerging diseases in public.
Are diseases that are first identified as
just like, diseases. Something you can say, this one is diseases, to have an understanding of the common man.
Disease is an English word. This is an illness, is a sickness. That is what a disease is. But what we are talking today are infectious diseases, which are diseases that move from one person to the other, one animal to someone else. Those kinds of diseases transfer to another person.
Okay.
Affect the communities, that affect the struggles and identity. Just But a re-emerging disease is one that at some point has been put in place. The disease is now under control. For a while, it is not a problem. So that is re-emerging.
Yeah.
So it was there long ago in the 70s and re-emerging infectious diseases.
All right. So from your definition, we can look at this.
For instance, we have diabetes. Those are non-communicable diseases.
So they are not emerging.
They have always been there.
That's what I'm saying. You said from your definition, you said we're talking about those ones that are infections. Why you are defining the emerging and re-emerging? So that was what I'm asking.
Emerging and re-emerging infectious diseases.
Okay.
So if you say emerging and re-emerging non-communicable diseases, we would define that. But what we are defining...
No, we are just talking about diseases generally. Yeah, that's our topic of today. Emerging and re-emerging diseases in public health. Yeah. So which one are we going to? Because you are the public.
We're talking everything. Everything the public wants to know. We're here.
Okay. So not just infectious. It's both the other way and the other way. All right. Thank you. So from your definition now, I think as a common man, as someone that is not in a helpline, we can name these diseases together from what you have defined.
Right.
Can we go?
Yes.
Both of us. All right.
Let's go.
All right. Let's go.
So for me, I would want to name the ones that are a problem to everyone.
Okay.
And for me, COVID is one of the
Yeah.
major. It's on the front burner,
Yeah.
right?
Chicken
and then we
pox.
have, okay, you could say that
Monkey
Lassa
pox.
fever, monkeypox,
Measles.
okay, measles. Those are infections. Yeah.
All right. Polio. All joint. Everything.
Well, they are all a problem.
All right.
Public health problem.
So, with what we are discussing today relating to the public health and our nation, Nigeria, and the state, Rivers State, is there any emerging diseases currently in Nigeria re-emerging?
Yeah, so I want to say the monkeypox is a re-emerging disease.
Okay, we have had it in the past.
Yes, we've had monkeypox in the 70s before.
Wow.
Yes,
And it was eradicated.
So it was no longer a problem of public health concern. But
Sorry, how was it not longer a problem? Was it still existing? Just like COVID now, we know that COVID is still around, but it's not that fearful like as it was in 2021, 20. So this monkeypox you are talking that has been existing, that has existed before, was it eradicated or it was still there?
So we did not have any cases. At least we did not report any cases from the 70s till date. I think the first set of the next set of cases started in 2017, at least in Nigeria. All right. Now the reason why we are looking at monkeypox as re-emerging is that it has gone beyond Congo where it started and in Africa, and it's now in Europe and other parts of the world. And we know that in this, I think sometime in July, the WHO has named it a public health infection of international concern. So that's why monkeypox can be said to be a re-emerging disease. So it was not a problem. I mean, you could have a case sporadically, but now we are seeing so many cases come up. So it has become something of concern.
That's somehow.
And
So,
of course, Lassa fever has always been there.
Yes,
You
but
know, it's there.
Yeah.
Even if it seems like there's not much focus, but there's still things we can do to prevent. And that's the essence of why we're having this conversation, what people can do, how they need to know that these things are there. It may not be in your neighborhood, or you may not know someone who has it, but there are people who are getting ill and who need not get ill.
They need to be on watch.
Prevented, yes.
All right. I want to ask, what are the factors can make these diseases to re-emerge? Factors contributing to them coming back again after they have been eradicated and declared free from a nation?
Now, several factors can lead to emerging or re-emerging diseases, and I will start with one. One is travel.
Okay.
International travel, people moving from one place to the other. So basically human activity, but one of them is travel. You find that COVID came from somewhere, right? Someone traveled in country with COVID. Even in the time of Ebola, someone came in with Ebola. So you find that there are diseases that are endemic. When you say endemic, they may be normal in a place.
Yes.
And they are not
like malaria, right?
Well, malaria is endemic in Africa here, West Africa, and of course in Nigeria. So you find that malaria is not a common thing in the US, for instance. But someone could go to the US and then have malaria, all right? Or the plane could go with the mosquito. If the things they're supposed to do, they don't do. If there's an infected female anopheles mosquito, so travel is one way.
Okay. So I want to cut it short. Sorry. Based on this malaria issue, it has been like a natural thing to us, like our sickness. Something you just say, this thing is our sickness. So you say endemic, and then you describe it that in something like US, they don't experience that. I want to ask: is there no something that we can do to just be like other countries and eradicate this malaria lot, because sometimes the thing will just come up as if there is a whistle that is being blown. You see hospital bed filled up, and they will call that one resistant malaria, that it can't go with just normal pills till you take some drips and all that.
So malaria eradication is a process, and like I will always say, there is a role for individuals, there's a role for the community, there's a role for the system. We know that malaria is caused by the bite of a mosquito, female Anopheles mosquito, and we know the environment where those mosquitoes thrive.
Okay.
So, for instance, if you keep a clean environment, you're not likely to have that mosquito. If you use the insecticide-treated mosquito nets that are made available, if when you are ill, you actually find out, is it really malaria before treatment? Because when we treat without even knowing what the problem is, that is when we have resistance to the common drugs that are supposed to be sensitive. So it's multifactorial. There's nothing somebody would do somewhere. There's a control program, and there are different pillars of that control. People need to know what they need to do. People need to know the symptoms of malaria, for instance, where to go to when they need help. But environmental control is also important. Indoor residual spraying. But even as simple as using mosquito nets that we are given, it's a problem for us. Register for antenatal, get the correct care. So there are things we can do to prevent this from being such a big problem for us. So this is part of human behavior leading to diseases and re-emerging of diseases.
Okay, thank you. Sorry, before we come back to this, I would like us to join our correspondents at Kana local government. Mr. Mishak, if you are on, take it up, please.
All right. Viewers, you are once again welcome to NOA Dialogue. This week, we will be looking at a medical team that has to do with the emerging and re-emerging of diseases in the public place. Now, here to do a good discussion on this topic with me is Dr. Kina Christian. He is the medical personnel in charge of Kana LGA. Doc, you are welcome, sir.
Thank you very much, sir.
So how are you contributing to this issue we are talking about? How do you look at this emerging and re-emergence of diseases when they occur and reoccur? What are the factors, what are the things that are responsible for this?
Okay. Thank you for coming first to the Department of Primary Healthcare in Ghana local government. And when you talk of emerging and re-emerging, we are looking at new sickness or new disease that we have not known before. Emerge, that's a new one, and re-emerge, the one that has occurred before and occurring again. That's what we are looking at first. Yes, there are multiple factors that causes disease to emerge. One, let's look at the environmental factor. We are all high risk. Waste disposal management is a factor that causes emerge and abuse. Some people are born with some genetic abnormality, so they are prone to some of these diseases that is coming with that.
No.
Okay. So I think we'll look at also, if I'm looking at, I also looked at the preventive method in terms of health. Immunization is one of the easiest means of this disease outbreak, and has been that has also been.
Problem. Bye for now.
All right, thank you. Before he come in, and the correspondent, the prof, contributed also to it, which was our attitude. We also talked about our environment that is like a contribution to these diseases being emerged.
Absolutely.
Yeah.
In fact, he just hit it. He just took it right out of my mouth. And I keep saying this is a public service program, and people need to know that it's not everything someone else will have to do for you. You have a role. What do you know? Where are you getting information from? Who is your source of information? If you know how to wash your hands, it will cut down on a lot of illnesses.
Yeah.
Whether emerging or re-emerging, whether day-to-day infectious diseases of even children. So knowing that you need to wash your hands as often as possible, wash it with soap and running water, as long as 15-20 seconds. Very, very important, and it will cut across prevention of all of these illnesses. Now we are talking, let's protect yourself and the people around you. Cough into your elbow, for instance, or cough into a tissue that you can dispose of neatly. So these are the things we're talking about. People's behavior, human behavior, our activities leading to diseases transmission.
I want to ask, someone who usually involved in community engagement, what do you think that this our nonchalant attitude, what have we done to it to make people at large concerned about their health?
So for me, we need to keep talking, and that's why we leverage on every opportunity to engage community. Now, over time, we have learned.
Sorry, I want to ask, like you said, we need to continue talking. Your office or your ministry, do they sometimes engage in town hall meeting?
Absolutely.
Maybe a program is coming up, like last week, we have child and maternal health week. Yeah. On a normal days, you decide. So
every day the ministry works. Remember, we have 23 LGAs, for instance, in River State. We have an office. We have different diseases. We have different programs. So as these programs, in the year you have a plan. So it means that at different times you're engaging different communities.
Let me open our telephone line so that the viewers can call in. All right, viewers, we are opening the telephone line. You can call in now. We are available to take your calls. And the number goes as +234 91 66 58. Public sensitization. Let's be civil. Thank you. Sorry.
Right. So I was saying that routinely for different things we engage communities. For instance, you look at a particular disease and we see the numbers. We know where things are getting bad or where the numbers are higher. How many people register for antenatal, for instance, how many people are vaccinated. We're seeing those things. So you are able to intervene where there are challenges. So different communities have different platforms that we engage them to. So on a regular basis, we engage with interfaith communities, the religious group, because we found out too that the religious leaders have a lot of influence on the people. We engage with community leaders, we engage with traditional leaders, and that's routine for different activities, especially as it concerns those communities. We looked at your correspondence. That is a local government health authority. The person that spoke is the medical officer of health in charge of the local government. So activities run routinely. So we are engaging communities. But you see, we have cultures, we have traditions that perpetrate some of these things. And we have a lot of information infodemic. So people are getting information from all the wrong sources and thinking that, this is how we do it, this is how we do it. So I always advise that you get the right information from the right source. Because one thing that makes you do wrong is ignorance. If you know that if you place this on the table, it will be stolen, you won't place it. If you know that the moment you turn, this will be stolen, you're not likely to place something of value on the table. So if people know that their behavior actually affects their health, and not just them, the people around them, their children, it matters that you breastfeed your baby if you know that in the future this child is likely to be more intelligent, is likely to be to make more money, for instance. You will look at that benefit and begin to do the right thing. So for me, I think that we continue to engage the community, make them feel like they are part of the decision making, because we need to provide local solutions to some of the issues. So how do we do it? What are the resources they have to do this thing right, so that it can be sustainable? When you leave, they are able to continue. That's the essence of engaging communities.
Okay, I want to ask, of recent, is there any disease that the public need to know of, any diseases that have been reemerged? We are talking about COVID-19 before. We talked about monkeypox. You say it existed in 1970s.
In the 1970s, yes, and it's back. And it's on the increase, not just in Nigeria, it's in Europe, and the numbers are increasing.
What of River State? Is it here now?
I think since 2017 to date, we've had a couple of cases. I think since this year, we have had up to 2 or 3 cases.
Yeah. So what do the public need to know how to concerning this monkeypox to protect themselves and their loved ones?
Now, so monkeypox is a viral disease. It's zoonotic. When they say something is zoonotic, it means that it's originated or it comes from an animal. An animal is the reservoir, and then it's transmitted through handling of that animal to a person.
Is it an animal?
Yeah, mostly bush animals. So you have antelopes, bush rabbits, those kinds of animals. So it's in the handling. I know that people have talked about, they said we should not eat bush meat. No, it's in the handling, because it has to do with body fluid. All right, and monkeypox presents with fever. It presents with rash. I remember you talked about chickenpox.
Yeah.
You mentioned that some people have monkeypox, but they would think it's chickenpox. So there is need for the public to know that there's a slight difference between monkeypox and chickenpox. Now, monkeypox, the rashes will usually come out between 1 to 3 days of the fever starting. But for chickenpox, we know that it's after the fever that the rashes begin to appear. For monkeypox, rashes start from the face.
Yeah.
It starts from the face, and it can go up to the palm, and it's usually big and pustular.
Yeah.
So those are things people need to know, because you need to present yourself. What we're talking about is you need to have a good health-seeking behavior. Oh, I have this symptom. Don't stay at home and say this is malaria, because that's all we do. Oh, this is how my malaria feels. This is how. No, go to the nearest facility. Tell the nearest healthcare provider, so that they will check. Now, nothing is confirmed until you have done the test.
Yes.
So we could have suspected cases, but until the lab result comes back and confirms that it is COVID, it is monkeypox, it is malaria, whatever it is, you don't say that this person has this disease. It could be a suspected case or a probable case. So people are encouraged to wash their hands. You see this washing of hand there?
Very vital.
Wash your hand very well. When you are taking care of people that are ill, be careful, because the transmission is through all those fluid from the crust, on the body, and even respiratory fluid. And that's why we talk about respiratory hygiene and cough etiquette. So when you cough, sneeze, even, laugh loudly, some things will come out. Yeah. So when you cough and sneeze, you cough into the inside of your elbow. Or, no, use what you need to use for everybody.
The emergence of these diseases, we should believe in what we have and use it to solve our health problems. Doctor, she is saying something. Reemergent disease that we treat, that is professional that does it, because she said we need to include our natural health practitioners. Natural health as in herbs and leaves.
Let me approach that we use. Multidisciplinary, meaning that different discipline, lab scientists, farmers, everybody
is involved. Okay.
Community workers, people, even people that talk to communities, they are part of the process.
I don't think that's what she's saying. She said natural health practitioners, not just member suggestion, drink salt. Natural health practitioners.
Where are they? Are they registered? That's where I'm coming to. Who are are they? Where do we find them? How do you recruit them? So they need to be under the regulation.
Yeah, okay, I get
If they are part of the health system, then
there is no problem. Their suggestions and opinions are accepted. All right, good. Let's go. Then, from out is glad. If the reemergence of disease is not properly diagnosed initially and treated by officers, I think what he meant from here is if it's not properly diagnosed initially, why should it reemerge again?
I don't understand
Listen
that
again.
question.
Is the reemergence of disease is not properly
So how do you diagnose something that has not been identified before?
he said reemergence. Is the reemergence of these diseases not properly diagnosed?
Remember that.
Just like, okay, sorry, let me get you to what he's saying. Just like you said of monkeypox has been existed in 1970 something and eradicated in Nigeria. Why did it come back again? Is it from us or imported to us? How did it come? Was it properly treated that can make it return back again?
So look at how, and that's why we are talking about how diseases come about. Remember, we started that conversation, but somehow either the correspondent, something took us off from our track. How do these diseases emerge and remerge? And we talked about human activity, how humans are relating with animals, because these are zoonotic diseases. So if a disease,
sorry to cut you, I just want us to be brief as much as possible because we don't have enough time for us to just go straight to the point. When the question is asking, this monkeypox disease, is it from us? Did it emerge from us or imported? Why did it re-emerge? Was it not properly treated? If it's from us, was it not properly treated? Because it's a communicable disease, it has to go from one place to another. Of recent, where did it re-emerge from?
Okay, so monkeypox came from Congo.
Of recent or previously?
From beginning, and even recently, it is all over. Okay. So the thing is, it's here. But if someone doesn't report and we investigate and we make a diagnosis, then we can't say that is monkeypox. Do you understand? I want to think that his question is not even related to monkeypox. He's talking about diseases that are not properly diagnosed and treated, coming back, and we calling it another thing. But remember, every disease that is diagnosed, that is identified, they identify it up to the organism that causes it.
Okay.
Do you understand? So monkeypox has a different organism.
Okay.
It's a virus. HIV is a virus. COVID is a virus. It's a SARS-CoV-2. So we've had SARS-CoV virus before. We've had the SARS virus. But this time around, this is the
to the public or the basic prevention habits to curb these diseases. I know you people might have some points on ground on the recent re-emerging. I'm coming, there is one re-emerging disease that was just on news day before, like maybe 3-4 days ago. But let's just accommodate our viewers before we come back to us. So, okay, thank you. Would you enable for watching with us, streaming live with us? Thank you. This is on Chidilo Bigwe. What measures as government or your ministry putting?
So the River State Ministry of Health has a public health itinerary, and one of the pillars is the risk communication pillar. Okay. So risk communication, what we are doing is engaging the community, giving the correct information. That's part of why I'm here today. Now we have the disease surveillance team too. Surveillance, they are there in the community actively searching. All right. So we have that, and we have the team that do sample collection. They are involved in labs. So if there's a suspected case, they go in, they collect the sample.
What of vaccination against it?
Hold on, madam.
Okay.
We'll get there. So I'm just telling you that there is a system in place that it could be anything. Now it is monkeypox. But before monkeypox, Lassa fever has been there. And we have been responding every day to Lassa fever. So what I'm saying is that there is a system in place and it is working. Okay? And of course, we're talking vaccinations. For now, there's no vaccine against monkeypox. But we have vaccine against COVID-19. And we're encouraging people, have you taken your first dose? Have you taken your second dose? Have you taken your booster if you're 18 years and over? Those things are available. Can we utilize the things that are available? So these things are there. Face masks. So there are coordinated efforts by government. It's there. Government brings about policies, directions on how to go about things, protocol, how you should conduct yourself, all of that. But people are to implement that. They are to ensure that if they say wash your hands, you're washing your hands. If they say wear face masks, you're wearing. That you should distance yourself, social or physical distance, that you're doing that. When there was lockdown, you were to stay home. So we have a role, but government is playing their role as they ought to. And of course, we need to collaborate with the private sector. Government alone cannot do a lot of these things. Yeah. So private sector participation is key. And then community engagement. We need the community people to understand that we want you to be healthy. It's not a scam. Because we go out there, we hear that, there's nothing like COVID, they just want to do this. So we want people to know that there are actually people suffering from these diseases. Actually, people have died. So you need to know that we want you healthy, and that's why we want you to assess these interventions.
Thank you so much. Thank you so much. So from what you said now, since there is no vaccination, that the only way of relieving the patients is just to wash them, maybe the period it has to stay.
There are treatments. There are treatment modalities in the facility. Supportive treatment. That's why we're saying assess the facility. Assess the facility, and then every other thing will be taken.
Thank you so much. I've gotten you. So viewers, for now, as she said, there's no yet vaccination, but once you see anything or any symptom, get yourself to any medical facility close to you. You'll be properly taken care of. And as you are doing this was upcoming and all that, what was the role of health facilities or maybe the risk communication group before the outbreak to the extreme of recording of deaths of about 50 children?
So that information is not confirmed as correct because the team has gone to the LG. So have you done any investigation to authenticate that information?
It was just on news.
Who gave the news? Was it any government functionary or
no,
just a rumor?
No, not just a rumor. From registered.
They have tried to find out. Okay, who are these children? Where are they? How many are they? Was there really any dead? And that's what we do. That's case investigation. When you hear something, you go up there and you find out what is going on, what are the issues. We have immunization campaigns that are held. What was the coverage of that coverage? So all those things.
Sorry, so from what you are saying, the information wasn't correct as we are talking to the public. So there was no outbreak in Abuadra.
There were cases of febrile illness.
Okay.
You need to make a diagnosis. Is it measles? Remember, we need.
That's why we are here to sensitize the public on the.
Exactly. So we are saying that if anybody had an issue in that LG, just the same way we are saying, if they were going to the facility, by the time you had 5 cases, 6 cases, 10 cases, there is no way that facility will sit down and wait for 50 cases. I don't know whether it makes sense before it becomes the news. No. So where are these people? Where were they? That's what I am saying.
Okay, I got it now.
That's what I'm saying. So I am not going
goes back to our attitude towards health.
Exactly.
Okay.
Where what is happening to the immunization post there? Are we using it? What is the problem? So I'm not here to dispute or to allude to. No, I'm just saying that situation need not happen if we are assessing the health facilities that government has provided, assessing the commodities that there are vaccines for measles. It's free, So are we assessing? And that's what we need to do. So it means that there's work for us to go back to the community. What is going on? I am from Abua. What is going on? Why is this happening? Okay? So that we know. And why were you home? Why wait till your child dies? No child needs to die. Yeah. When we have, vaccine preventable diseases like this that we provide for. So that's my take on it.
All right. Sorry, as time is not on our side, we'll be rounding off. But before we round off, I would like you to bring in summary what you have to tell the audience towards health issues and protecting ourselves and the country.
So I want to summarize what we have talked about using the acronym RISK. And I want to say R is remember to get information from the right sources. Right source of information will deliver you. When the Bible says, my people perish for lack of knowledge, is the God's people. So there are people that should not have issues, but they perish because they fail to hear the right thing and to do the right thing. So get correct information from the Ministry of Health, whether the Primary Healthcare Board or the NCDC or the WHO. Get the right information. And I is get involved. Don't say it's not my business. It's a disease of the rich people. It's for big men or all of that. Get involved. Do that bit you're supposed to do. Wash your hands. Maintain social distance where you need to. Use the face mask where you need to use your face mask. Do what you need to do. Handle linen in the hospital right. Make sure that you use universal safety precaution. Use personal protective equipment when you need to. And then you go to S. S is seek help. Seek help. We've talked about it. When you have an issue, don't sit at home and self-medicate. One of the things that makes us have drug resistance to whether it's as simple as malaria or anything, or antibiotics, is because we take drugs that we don't need part time, and we don't even take it correctly. We don't take the correct test to you. Call the numbers that you're given. Do something. Seek help. And then, finally, while you do all this, keep your environment clean. Keep your surroundings clean. You could be saving your children. Children under 5, pregnant women, they are more at risk of dying or getting serious malaria. So, as simple as keeping your environment clean, making sure that you wash food, cover them. When we talk of Lassa fever, is keeping your environment clean and ensuring that rats don't come around, that you store food in closed containers. Simple things that you can do. Do the bits that you can do. And then let government and other agencies do what they can do. I think I'd like to wrap up.
Thank you so much. Thank you so much, Doctor. All right, I would love to leave us some of these facts that she has given to us. First and foremost, always take preventive measures. Washing of hands is as simple as nothing, but it does us a lot of good to treat by yourself. Don't prescribe any drug for yourself. Take your vaccination. Maintain proper personal hygiene. Though, even as we do all this, sometimes this sickness may come to us. We can't stop them. But I assure you that taking preventive measures is more to bring more leaving us with this illness than lose ourselves on guard. When we take preventive measures concerning these things that have been discussed today, even when the sicknesses comes, it will not be severe as it ought to. But when we lose our guard, it will be severe and sometimes it may lead to death. So I encourage us to always take care of ourselves, protect ourselves and our loved one. All right, and I want to appreciate Dr. VETTY once again for coming through. Thank you for the so much knowledge revealed to us on this platform. It was a time well spent. Thank you so much. And also, we want to thank the executive producer of this program, Dr. Gaba Abari, the Director General. It's going. Thank you so much, sir. We also want to thank the studio director. I call him my boss, Mr. Briggs Aroreye team. Thank you so much, sir, for making this program very seamless. Thank you for your sacrifices. We will never forget his assistant, Mrs. Boma Amadi, who is behind the camera, assisting to make this program a fruitful one. Thank you so much, sir. And to you viewers, this appreciation will not be complete if we did not thank you. Thank you for joining us today in making this a memorable one. Thank you so much. And remember, just like Dr. VETTY said, when you see something, say something. Protect yourself and your loved ones from any ill health. Remain blessed and see you next week. Thank you.